Very well then, welcome back. You're watching Takeover on NTV, Africa's biggest tech conversation and show. As we talk about the revolution around technology, there is also another very revolutionary thing happening. Health services are moving from the facility as you know it, the healthcare facility, into more concentrated and more personalized services at home. And you can actually do what I would call health hauling and call a medic to your home to attend to you. Or if you're one of those people who calls home or travels home when their mom is sick to go and sort their issue out, then you need to listen to this next startup. Ladies and gentlemen, this is the story of M-Clinic on Startup of the Week. Health services have predominantly been rendered in a medical facility like a hospital or a clinic. With a growing demand for convenience, a Kenyan nurse, Lea Mbuya, and her team came up with M-Clinic, a platform that enables patients and those with medical emergencies to ask for medical services and get them at the comfort of their homes or on emergency sites. When Takeover caught up with her, she painted a typical Kenyan scenario of how seeking healthcare in the country can be a challenge.
Indirectly or directly, we have been affected by the health system that is ailing. One way or the other, some of us as friends, we have experienced the issue of not getting an ambulance. Evacuation in Kenya is a crisis. You get sick, you cannot get somebody to evacuate you. The other thing, we realized that accessibility of health has become an issue in Kenya. Number one, we produce the best healthcare workers in the country. And that's why we have a lot of exports of human resource. But Kenyans are not the consumers of the human resource we produce in the universities. So for us, we give the healthcare workers a part-time job, just like an Uber. When they are out on off duties or off days, they get to the app, they get a job from Kenyans who are needy of the services. And one good example we say, why do you need to go for a dressing to a hospital? Line up for 6 hours, minimum turnaround time, come out in that hospital with pneumonia or TB or even COVID, when the dressing could have been done by your neighbor who is a nurse, who is online, and you can be able to call them with an application. So today, there are several medical services that do not need to go to a hospital. Pre-hospitalization and post-hospitalization care. A good example, we have a lot of mothers who are struggling with breastfeeding, which I know the men may not get to understand that breastfeeding is not as natural as people think. Oh yes. Yes. What happens? Most of the mothers, they end up getting what we call engorged breasts. Yeah, there's swelling, there's a cracking of the nipples. All these advice can be given by a human resource in the health sector, but they don't need to go to the hospital for that.
With over 20,000 health workers signed up on M-Clinic countrywide, the application is solving the problem of access to healthcare and affordability. It works on the principle of healthcare of confidentiality while exercising professionalism. Functions with Virtual Clinic allows patients to consult with healthcare professionals remotely.
Your own privacy, if you don't want virtual that is video-based, we have audio that you have 24 hours consultation with a healthcare worker. And if you feel that you need a touch of a healthcare worker, they will come to your doorstep. Our main aim is accessibility. We bring healthcare to your doorstep. You don't have to go to the hospital comes to you. And in a normal setup, a healthcare worker will work for 3 days and have 4 days off. What are they doing for the other 4 days? Are they utilizing their skills to help the community? And with that, they're also earning when you give them the job. So, for us, we have 4 major rider programs in M-Clinic. Evacuation, medical concierge, which I'll talk about, that is very interesting, medical home visits, and virtual medical consultation. To start with, medical virtual consultation. That is something interesting that we are doing it differently from what other people are doing, because for it is being done elsewhere. Number one, we are doing what we call Kenyans for Kenyans. You may ask, what is that? Kenyans for Kenyans, we realized that we have quite a number of Kenyans in diaspora with mental health issues. Today, if you want to afford a session in UK on mental health, it is 20,000 Kenya shilling. For us, per session, and minimum sessions are 5. For us, we are assisting Kenyans in UK per session with 7,000 shillings. We understand their space, we understand the culture, we understand the struggles of Kenyans when they are abroad.
Before healthcare workers are onboarded on the platform, they undergo a rigorous verification system. Leah says this is the most crucial part of their business, as they have to uphold quality at all costs.
We work with National Nurses Association of Kenya, the National Association for the Clinicians. We are bringing the KMA on board for one reason. All our healthcare workers have to be licensed, registered, and have a valid license. Yes, we filter them. And our app is in a system that if you are rated less than 3, you are removed for disciplinary. So just the way you rate an Uber driver, you can rate our healthcare worker. If you don't like our services, we remove them. We'll go through the whole system, understand what happened, but by that time, you'll be offline, not accessible to the citizens. Because for us, we want to give quality healthcare that is sustainable.
And that's our startup of the week.